Whakalawhalahi atu e lilifu he whare, whakau e whamua ke he matua he langi. He lewe ki mai atau tūru, ko mai ke liu whalewe he awhia whinei. Whakau e lahi ke a whaka moko le, vika moko le. Ko ka mata e whakawhitu ianga ha tau tūru. Ka mena ne mua ke whakalilifu ke he tau tangata osi. Whakalawhalahi atu, ma niue whekai. I've run out of hands. Tēnā koutou katoa, e tuake au nei kia mihi kia koutou. Ka mihi au kia rangi nui, e rāua ko papa tua nuku. Ka mihi au kia tane mahuta, e te kaitiaki o te ngāhere. Ka mihi au kia tangaroa, e kaitiaki o ngā moana. Ka mihi au ke ngā mātua tipuna kua wehe atu ki te pō. Ka mihi au ke ngā maunga ma ngā awa o tēnei rohe. Ka mihi au ke tangata whenua i tēnei rohe. Ka mihi au nā tamariki, no reira, kia koutou katoa, ti hei Māori ora. Talawhalawa, mālo e lelei, kia orana, ni sa mbulawenaka, mālo ni tāloha ni Māori, and warm Pacific greetings. Sorry, I was meant to have done this. So in the time that I have, I thought I would share some thoughts with you. Firstly, it's not quite the Oscar ceremony, but I do need to thank some people and acknowledge I didn't get here alone, as you know. Journey is an overused word, but it is a journey, and the journey continues. And I've selected a few papers. Some are quite old, but relevant, I think, and some highlights, and I'll finish off with some reflections for us all. Hau I tonga lupo, alof te kilau. Matua tupuna ha mautolu, Tukuitonga, hau I alofi te kilau. Mo e matua tupuna fifine sovaleni, hau I tungulu tamakautong. I also want to acknowledge my Pākehā family from Mataura in the deep south. I think Rowena and Tricia are listening in. Thank you to all of you who sacrificed your evening to be here. And I'm aware that family are listening in from the rock. I want to acknowledge Susie, life companion, ardent supporter, and sometimes harshest critic, but in a nice way. Thank you. None of this would have been possible without you. Terrell, Mike, MJ, Catherine, Dr. Londine, who's not here, Chanel, who got lost on the way, Sophie and Isaac, and my in English you'd say cousin, but he's actually my brother. We were raised together. Kalapu, thank you for being here. And of course, my siblings Netta in Perth, Renee in Niue and their families, and my late sister Joss, and of course the entire Tukuitonga clan. And there's a lot of them. I want to acknowledge Regional Director Piukala. I was absolutely ecstatic when he was appointed to the region. Clearly we need to do better than we have done. So I was very happy when he was appointed. Jude, thank you. And colleagues from Te Potoko. Warwick, pleasure to work with you. Thank you for your remarks. Jemima, Matire, Paparangi, Rhys Jones, and all the colleagues from the faculty. Kara, Oksenengafa, Billy Nosa, Roanne, Sam, the whole crew. Sorry, Lisi. You'll be pleased there'll be no more requests for new slides. My help. That was meant to come earlier. Is this thing working? My PMA family. The slide on the right, two pioneering Pacific surgeons and a wannabe surgeon who didn't quite make it. Lord Tangi and Kiki Mawate, and the one on the left, of course, is our sister Debbie. Maybe I'm not pointing it in the right direction. Here's the rest of the PMA family. Most of you will know that I haven't followed a traditional academic route, but I've had some interesting roles in some interesting places, and I hope that my contribution has been useful. Most of you will know that I was born on the rock. That explains my good looks and fierce independence. I left the island when I was 16 to study, because in those days, school certificate, New Zealand, some of you will remember this, the New Zealand school certificate was the highest qualification you could get on the island. As it happens, regionalism had become a buzzword for political leaders in the region. And the University of the South Pacific had just been established in Suva in 1968. And a number of us were fortunate to secure New Zealand government scholarships to USP, and in my case, the Fiji School of Medicine. The Fiji School of Medicine was established in 1885 as the Suva Medical School. And over the years, FSM had trained many of the Pacific leaders, not just for medicine. I'm convinced that the scholarship from the New Zealand government was a critical factor that enabled me to train education and training in medicine and public health. Otherwise, I would probably still a farmer or a fisherman on the island. Two major influences for me in those early days. There are a lot of problems with Catholicism, but there's some very good things about the faith. And one of those is social justice. So this is a picture of us in 2015, just before the Paris Agreement. Dame Meg Taylor on the right there had organized for us to go and visit Pope Francis to seek his support and guidance. And the bald head guy at the back was the technical officer. But you'll see in this photo Prime Minister Fiame, and to the right, President Hilde Heine and Eduardo Fritz from French Polynesia, some very influential figures. And as it turned out, I think the Pacific leaders did a tremendous job at the Paris Agreement. Nobody had given them a chance, but they spoke loudly and the rest of the world heard them. Since then, of course, some influential people are dragging their feet, and the Paris Agreement is at risk. But Catholicism, and particularly social justice promoted by the faith, had a profound influence on me. The other one, of course, was the Tukuitonga family. I'm a Catholic boy from the island. This photo means a lot to me. Although I was barely saying hello to the man, and his minders were shoving us along, like, move on. So anyway, so big extent. The other influence, obviously, was my family, and big extended families are synonymous with Pacific people. So this, some of my family. Mother had 14 siblings, and all of them were mums and dads of some description. You know, it's hard to avoid a big family, whether you like it or not. I was fortunate to be raised by my grandparents, Niuean tradition and practice, and Granddad was a practitioner of tough love. If you lose a scrap with your siblings, you're in trouble. But he was self-taught and instilled in us the ethic of hard work and not relying on other people. At this point, I also want to acknowledge and remember my primary school friend, Richard Hipa. He was the silent voice that said a lot to me. We went to primary school together, and of course altar boys at St. Joseph's Catholic Church, and he was a guide and friend throughout all those years. Unfortunately, my friend passed away earlier this year. His father, Dr. Dick Hipa, and Dr. Harry Nemaya were key influences in helping me with my decision to train in medicine. And I think you'll know that life on the island was pretty basic. I remember hearing the radio for the first time when I was 10 years old. Books were hard to come by, but we managed somehow, and a number of us went overseas to study. In my case, I went to Fiji and graduated in 1979, so I'm telling you now how old I am, and returned to Niue in 1980, where I was introduced to primary care. It was expected in those days that doctors would not only practice clinical medicine, but you were engaged in public health and contributed to public health and preventive medicine. This is a slide partly to show you that I had hair at one time. But this is a unique phenomenon that I regard as one of the best models of care. We'd get in a Ford Transit with a nurse and a trunk full of medicines, and we'd drive around the island 3 or 4 times a week. and you'll see in the foreground a red flag. So if you're crook or your child is sick, you put out a red flag in the front and we'll come and see you in your house. For free, I might add, or free to the user. As I say, I was influenced quite early into public health and primary care. In 1985, there was an outbreak of dengue on the island. So I was not only involved in the provision of care to people, I was also involved in surveillance and mosquito control. So this is my very first paper that got published with Terry Maguire, who was running the virus laboratory. In 1980, this thing has a mind of its own. In 1986-87, I was recruited to teach public health at the Fiji School of Medicine. Unfortunately, many of you will know that 1987 was a significant year for Fiji. And I'm on the record as saying I was driven out of Fiji as a refugee, and that's when we arrived in New Zealand. It wasn't the easiest transition. I had to go through a process of registering in New Zealand, and all that was required. And in fact, there was very little written about Pacific people in Aotearoa in those days. Sitaleki Finau was the sole voice, and we heard about his teachings today. But together we started to introduce the idea that there's room for study, research, and teaching in Pacific health. So following the registration requirements, I started training in public health. And this amateur-looking book was my project for the college. And it was the first time that someone had pulled together material that talked about the health of Pacific people. I think if you look back at it now, you'll know there's probably a lot of errors in this, but it was mine, and it was the first time we had done this. The other thing I was doing at the time was I had continued to be a GP, mainly in the West and sometimes in the South. And I remember feeling quite frustrated by it all, because you kept seeing the same things, particularly kids coming back with ear infections time after time. And you had to say to yourself, surely there's a better way. But this led us to set up the whono. It is now, I think Tevita might be in the room, is now one of the largest providers of primary care in the country. But this was us, founders of the whono out in Henderson in 1989. Clearly a number of other clinics have emerged since then. In terms of publications, in 1990 I published for the first time in the New Zealand Medical Journal a paper on cardiovascular disease. Again, at that point there wasn't much written, and so Robert Beaglehole, Alistair Stewart and I published the paper, and showing, of course, that cardiovascular disease was a problem in the Pacific community, somewhere between the mortality rates of Māori, which is higher, and Pākehā. It's still the case, I understand. Robert, by the way, and Ruth became lifelong mentors, and I want to thank and acknowledge them. Subsequently, we went to talk to David Hay, the same David Hay who got laughed out of the Air New Zealand office because he dared to suggest that they might consider smoke-free flights. But David readily accepted our bid, and the Pacific Heartbeat Program was established in 1991. That's the team. A number of people have been involved since then, and they run nutrition-related programs, and they still do. They do a good job with regard to cardiovascular disease prevention. I'm just going to go through now some of the other papers. We did one on breast cancer with Collin, showing delayed presentation, higher mortality. But at that time, for the period we were looking at, the incidence was thought to be lower. But of course now, breast cancer is a real problem in Pacific women, and screening is still not quite what it needs to be, and mortality remains high. Another paper was on childhood admissions to hospital. Again, showing for the first time that childhood admissions, particularly for respiratory conditions, was a problem. Thought to be related to overcrowded housing, passive smoking, and the stuff that will be familiar to you. One of the joys of my life was the formation of Pacifica Medical Association. And Debbie Sorensen, who will speak later, a number of people in this room put it together. This is quite a big meeting in Christchurch. PMA does a number of things, including the medical referral scheme and emergency provision of emergency services in the region. I was also fortunate to be awarded the Harkness Fellow in healthcare policy, where I spent 12 months at UCSF in San Francisco. I'm grateful to Professor Peter Gluckman and Colin Mantell for this opportunity, where I was able to join others from other parts of the world to look at the US health system and see how it compares with Aotearoa. My advice to you would be the USA health system is a good lesson on how not to design and deliver healthcare. During that assignment, I was able to, we published this paper on interventions for heart disease in New Zealand, and pretty much showing that morbidity and mortality was higher in Māori and Pacific people, but intervention rates like cabbages and PC in those days was lower. This is not fantastic. Just to show that it's my contribution in the academic papers is not all old. This is a recent report that we launched last year, looking at health systems in Tonga, Republic of the Marshall Islands, and Vanuatu. And for those of you who are interested, some very interesting findings there. For the next little while, initially with the appointment as the Director of Public Health here in New Zealand, I want to acknowledge and thank Don Matheson for giving me that opportunity. He's remained a colleague and friend since then. Within a few weeks of taking up my appointment, some of you will remember the world faced the threat of SARS, severe acute respiratory syndrome, and I found myself becoming the expert on SARS, not knowing a lot. In those days, of course, we didn't have the networks or the information that was needed. Fortunately for SARS, it was quite limited, and certainly nothing compared to what Ashley had to deal with COVID-19. Francis Ross is in the room, and I thank you for coming up, Ross, Francis. Frances taught me a lot about media and communications. In fact, she taught me all I know about public health communication. I was also fortunate to be appointed to be the Chief Executive of the Ministry of Pacific Island Affairs. The ministry has a long history, established by the Labour government in 1990. And funny enough, Richard Prebble was the first minister. I was recruited at a time when the ministry was struggling. I have to say that it was probably the most unproductive period of my life. Terrible ministers, very little money, and really dreadful public service. Why are you guys special? What's different about you, etc. And I hope that clearly the ministry has changed the Wellington attitude since then. But despite all these challenges, we were able to reposition the ministry and start to deliver a number of services. Can we go back to the meetings one? Yeah. In August 2003, I joined the World Health Organization. The World Health Organization had been buoyed by the adoption of what's called the Framework Convention on Tobacco Control in 2003. And the belief was that we could do the same with food. Food, of course, is very different. And in the end, we didn't develop a framework equivalent, but a watered-down version called the Global Strategy on Diet, Physical Activity and Health. I have to say that my overwhelming memory of my time at WHO, apart from living in Europe and having access to cheap EasyJet flights around the continent, was the number of meetings. And that's why there were just endless meetings, which I am not sure had the impact that people were hoping for. Endless meetings, global meetings, regional meetings, national meetings. I'm sure the World Health Organization has contributed much to the improvement in the health of people around the world. But I do think that the United States withdrawal from WHO may have forced the change that's required. I was privileged to be appointed the Director General of the Pacific Community between 2014 and 2019, and they still do tremendous work. Paula Vivili is here. SPC provides technical support and scientific advice to the Pacific Island countries in a number of areas. And this, again, is a highlight where I presented the position of the Pacific to the UN General Assembly. It's been a pleasure rejoining the University of Auckland. We've been able to support Paparangi and the MAPAS team, and those who want to review and change programs like ours really should offer an alternative. You can't just discontinue programs without offering another solution. Our health workforce needs to reflect our country. Based on the successful Māori Whakapikiake initiative, we established Wayfinders in 2021, supporting young people to consider a career in health. We were also fortunate to start a program on micro-credentials for Pacific adults who do not have the prerequisites for tertiary education, and this is a graduation class from 2024. And the other significant development for us is the formation of Te Potoko Ora a Cure, and this is the dream team. one old bloke and several young women, and the centre has done some tremendous work for our country and the region. These are the focus areas that we are working on. Next. In October last year in Apia, the Commonwealth Heads of Government, I was delighted to be part of the group that helped set up the Pacific Academy of Sciences. This is the first time that the Academy has been established for the region. With the assistance of Professor Peter Gluckman, the Australian Academy of Sciences and the Royal Society of New Zealand, we've been able to get the Academy underway. So that's a quick run through of some of the initiatives that I've been involved with. Clearly not just me, a lot of people are involved, but I'd like to think that instead of just being a traditional academic writing papers, that a lot of the things that I get involved in translate into practical things on the ground. So just to wind up looking back, New Zealand has a good health system. It's struggling, obviously, at the moment, but it's good for most people, most of the time. But if you're Pacific or Māori or older, or you live in rural New Zealand, it's not great. But it's important to acknowledge that there are good parts of the health system. A large part of these things are shaped by underlying socio-economic conditions, housing, employment. And clearly, in order to address those differences, we need to address housing. We need to address employment and education. And it is my view that the various reforms over the years has not really addressed the issue of inequities. My view is that the formal health system is playing catch-up with the Pacific community. The formation of clinics, Pacifica Healthcare, Self-Seas, were developed by communities and healthcare professionals without formal policy and resources from the government. And in fact, the contribution from the likes of the Provider Development Fund is really catching up with initiatives that had been developed and delivered by the communities. Looking forwards, I think the two main drivers of the cost of healthcare in our country is aging and inequities. In other words, we've got to take inequities seriously and obviously try and improve healthcare for older New Zealanders. Profound demographic change is underway in New Zealand, and I'm not sure that the policy makers understand this. By that I mean more Māori, more Pacific, fewer Europeans, and we need to think about that a bit more carefully. Widening wealth gap, I think we're becoming a mini USA. Fewer and fewer people are amassing the wealth, and more people without it, and the gap is getting wider by my reading of the literature. In other words, I think we need to develop and deliver decisive and determined actions to address inequities. I think we have every opportunity to build our centre, Te Potoko, into a world-class entity, and that's my hope for the little time that I might have left in the facility, and we are looking to secure WHO collaborative status for the centre. I do think we need to protect MAPAS in order to build a workforce that reflects our country. Ladies and gentlemen, a quick run through of 40 years of experience. Thank you very much, Fuele.